National Non-Resident Visitors Health Insurance Scheme, or if you want, policy. Because this morning we woke up to a statement from the Ministry of Health, signed by the Minister of Health, indicating that it was only a proposal from the National Health Insurance Authority. What we have done this morning is to show you the period when Kwame Menu, then Health Minister, launched this, at the time when Bernard Okuboy was actually the CEO of the National Health Insurance Authority. So what's all about this, and why is it generating a lot of issues or controversies? Kwame Sarpong Asiedu is a pharmacist. He is a fellow of CDD Ghana, and he's joined us via Zoom. Kwame, good morning, and thank you very much for joining us. If you could kindly unmute, Kwame, so we can hear you.
Yeah, great. Good morning, Raymond and Winston, and good morning to all listeners.
Great, Kwame. So, Kwame, I mean, we've been talking about this. You started by asking a few questions, even on social media. What do you make of all of this and the back and forth? Now, government says it's only a proposal from the National Health Insurance Authority. It's not a policy of the government.
Well, I think this whole thing needs to be unpacked properly. And why do I say that? I mean, let's get it straight. Nobody who is right-thinking would doubt the requirements for insurance on health at any point in time, especially when globally we are marching towards universal health coverage, which is clear that money should not be a barrier at a point of use of healthcare.
Sure.
So obviously, that must be put in context. But then here is the thing. I've seen a lot of people have a number of conversations around this whole thing when it came out first as a snapshot, because obviously a lot of people hadn't read the policy. And I kept saying on social media that there was a policy, and in the next few days, things would start coming out. What do I mean by that? By travel convention, there is a clear definition for a visitor and a temporary resident and a permanent resident. The clear definition is normally below 6 months. If you are sojourned in a country for below 6 months, unless, of course, you're on a contract, like you're going to do some research work or some educational foundation or something like that, or you are on a speaking tour, you are generally considered a visitor. Normally from 6 months to, depending on the country, let's say about 5 years, you are a temporary resident, after which permanent resident status kicks in. So generally, between the 6 months and the 5 years, there is normally for most countries a requirement, because you're a temporary resident, that you have an insurance cover while you're resident there. In most countries that are covered by welfare states, the UK in which I live, for example, and a lot of the Scandinavian countries, there is a health monopoly when it comes to the health welfare state. What do I mean by that? Like, you come to the UK, there's the National Health Insurance, National Health Service, which provides health to all, irrespective of status. But they are private insurances as well. So that welfare state insurer is the one who takes what's called the health surcharge for the temporary residents. But when it comes to visitors, when you are traveling, if a country requires you to have insurance, they state it as a requirement. They don't demand of you to purchase it from them. Some countries, like in Scandinavia, would even give you preferred insurance companies. They'll list a number of preferred insurance companies. But that doesn't preclude you from taking insurance from a preferred provider of your choice, as long as it can be used in their country. Because they know that there are some people, like diplomats and those who work for the United Nations and all that, who can be visitors but are covered by other forms of global international cover. So you cannot force such people to buy insurance from you. So the first thing for me is, when I saw this, that was why I asked my questions. Was it a monopoly for the visitors? Because by law, even the National Health Insurance Act that you read gives the NHIS a monopoly to provide insurance for those who are temporary resident in Ghana. But the question then became, if someone was traveling into Ghana who had insurance cover which could be used in Ghana, did they need to get this insurance as of necessity? That was the first thing. The second thing that came to mind was when you read the statement that has been released by the Ministry of Health today, it clearly states that, it's a proposal. It's not been discussed as cabinet. But the quote from Graphic was clear that Dr. Bernard Okoboy said this was going to start on the 1st of July. That gives me a lot of jitters, because if it's not been discussed by cabinet, how was Dr. Bernard Okoboy unequivocal in stating the date? Unless, of course, he's telling us that Graphic is reporting false news or have misquoted him. If they haven't, and the statement doesn't deny that, and if they haven't, then the next thing comes in. Under what sort of law were they coming? Were they coming under a legislative instrument? Were they going to go through parliament? Were they going to go through an executive instrument? And even if they were going to do that, and the information came out yesterday, how long does it take for these instruments to mature? So when you put it all together, then it means that one of two things is happening. The politicians came to test the water because, like you rightly said, there's been a policy since 2023. There was a launch in February by the former health minister. So I think what has happened is that they've come to test the water, because if you realize, a prize was quoted as well, attributed to the current health minister. So if it's not been discussed by cabinet, if it's not gone to parliament's fees and charges, how was he so categorical in putting these informations out? That, for me, leaves a lot to be desired. So then the question is, if we are going by his statement of today, which says that, it's going to be an NHIA thing, we need to ask, has the NHIS or NHIA set a fee for these visitors? If they've not, then where is the fee that Dr. Bernard Okoboy was quoting coming from? These are my initial concerns. And this, for me, needs to be interrogated to its lawful conclusion, because we cannot be wish-washy with some of these things, and people come, they test the waters, and then they go away, they test the waters, and they go away. I don't think that is a good approach to health policy. Finally, what I would say is, if you listen to Dr. Da Costa, when Raymond interviewed him, he said this was going to be a revenue stream for the National Health Insurance Scheme.
Yes.
So if it was going to be a revenue stream for the National Health Insurance Scheme, how have the actuarial scientists worked it out? Do they know the premium? Do they know the footfall of visitors? Do they know how much is going to accrue? What are their projections? We need to know that as well. So there's a lot that comes out from the court, the Graphic report, and the statement that has been released this morning by the Ministry of Health. And if you are minded, like I am, to read the policy from last year, you would realize that there's someone not giving us the full picture. And that, for me, is not good enough.
When you read the policy, since you've read the policy, when you read the policy, what do you sense we want to do with all of this?
Well, I sense, like I said, no right-thinking person in health would disagree with the fundamental principle of having health insurance for visitors. I sense that we want health insurance for visitors coming into the country because one of two things: we do not want them to use our public hospitals. That is, even if they would use our public hospitals and not pay the bill or become a burden on the state. But we also all know that a lot of these visitors who come use the private and quasi-government facilities anyway. We all know that they will tend to go to private doctors if they have to. Even a lot of the, embassies in the country as well, they use other health facilities apart from, the public ones. But then we also know that when it comes to certain specialist services, they would have to use the government facilities anyway, because some of these services are only available in the government facilities. So I sense that that is the thinking of those who noted this idea, that you need to have a form of health insurance. So should the unfortunate happen, and your health takes a negative spin, you would have something to fall back on.
Now, is this thinking bad?
No, it's not. I have said from the start, that was where I started my conversation from that. Because every country globally, we are going towards universal health coverage where finance should not be a barrier at the point of use of healthcare. It would be difficult to disagree with the policy. The policy in itself is not a bad thing. And globally, a lot of countries do it.
But you've asked other questions also. You've asked questions like who's going to be underwriting it and all of that. And I know you have basis for these questions. Why these questions?
Because often when politicians come to test the waters and they are unequivocal, as Dr. Bernard Okuboy is attributed to have been, they go by what we say proverbially in Twi, that when the blind man says he'll throw a stone at you, he should surely have his leg on a stone. He should surely have his leg on a stone. So we need to know what stone they are stepping on. And that is why I've asked that question. Because there are rumors, and I'll not put the name out, but there are rumors that there is an insurance company selected to underwrite this. And if that is true, then we need to know the process of the selection. And that is why I'm asking your questions.
Okay. Now, I look at the policy and says the National Health Insurance Authority is the statutory agency of the Ministry of Act and Hood, will, with the object to attain universal health insurance coverage in relation to persons in the country. But I see a part of the document, okay, yes, 25 says, the National Health Insurance Authority will ensure that only private commercial health insurance schemes are qualified to apply for license to operate under the NNRVHIS, and that's actually the National Non-Resident Visitors Health Insurance Scheme.
Thank you. So now, Winston, you see why I asked that question. I asked that question because there is some disingenuity in the statement that the Ministry of Health has put out today. The NHI is the regulator, is the statutory regulator, but they are not going to operationalize this. And private insurers are going to, and that is clearly stated in black and white.
Yes.
The question I ask is, who is or are these private insurers underwriting this policy? Because it is stated in black and white in the policy. And that was why I was saying on social media yesterday, because I didn't want to get into an argument with people who I knew hadn't read the policy. So you remember when you asked me why I was asking the questions, I told you that in the coming days, it will become clearer. And now, you've read the policy and you can see clear in black and white. So anyone telling you that the NHIA is going to be operating it is not giving you the accurate information. They are the regulator. There would have to be a bid to identify the private insurance companies. Who are they? And that is what our eyes should be following.
Yes, and talking about that, it says, in this regard, a certificate of qualification and capability of healthcare providers and facilities will be critically assessed to ascertain their ability to effectively provide healthcare services under this.
So you've gone to my next question that I asked, and that is, how were they selected? When was this tender opened? Do we have transparency in that respect? So now, Winston, you clearly realize that I was asking the questions because I had read the policy and I knew the process by which we had to get to a point where an insurance company or insurance companies are selected. And that was why I was a bit edgy when I saw the unequivocal statement quoting a cost and a timeline. Because the things that should happen before this is arrived at hadn't happened, or if they had happened, we're not aware of it. So was it sole sourcing? If it was sole sourcing, why?
Interesting. Well, the questions will continue. Kwame Sarpong, Asiedu, we're glad that you made time to join us this morning. We'll go through the policy for those who do not have the benefit of reading it so they can have a better understanding. But we are glad you're able to join us.
Thank you.
And that's Kwame Sarpong Asiedu, who is a pharmacist and a CDD Ghana fellow. Raymond, so there you have it. I'm sure you've seen the policy, which is actually on the website, Raymond, of the National Health Insurance Authority, or maybe you still insist that's a proposal?
Oh, policy rationale 1.3 is the section.
Yes, go ahead.
Yes, the need for a policy for a mandatory NNRVHIS arises from a considered evaluation of the existing gaps in healthcare coverage for non-Ghanaian passport holders who have been visiting the country over the years, in line with health insurance global best practices and the provisions of Act 852. The policy is poised to facilitate a structured, comprehensive, and digitally streamlined health insurance provision, thereby safeguarding the well-being of non-resident visitors and fortifying and enhancing the country's healthcare infrastructure system and its international appeal. 1.31 Addressing accessibility to healthcare services across the country. It says here, as an emerging destination for business, tourism, recreation, pleasure, and other reasons, Ghana prudently recognizes the importance of ensuring that non-resident visitors, regardless of their purpose or duration of visit, have unmitigated access to standardized and comprehensive quality health care at their disposal throughout their visit in the country. The NNRVHIP seeks to ensure that non-resident visitors to Ghana, while navigating through the rich tapestry of culture, business, and scenic beauty of the country, are shielded from potential health-related financial adversaries. This policy, therefore, acts as a safety net, safeguarding non-resident visitors from unforeseen medical expenditures whilst facilitating unimpeded access to essential healthcare, such as any part of the country during their visit. Preemptive risk mitigation is 1.31. These are the reasons for the policy anyway. Now, the cognizance of risks associated with international travel, particularly those pertaining to health, have been heightened in the current global context. In this regard, this policy is envisioned as a tool that preempts and mitigates this risk by ensuring that non-resident visitors, irrespective of their health history and conditions, are adequately covered during their visit to Ghana. This policy emphasizes a no discrimination policy, ensuring that all non-resident visitors are privy to the available comprehensive healthcare coverage, thereby fortifying Ghana's stature as a safe and accommodating destination, particularly for health insurance. The next one says facilitating seamless health care experiences, and it concludes by saying, in line with Ghana's stride towards digital transformation in governance and service provision, this policy will ensure that the process of acquiring and managing the NNRVHI is streamlined, transparent, and efficient. The digital approach will not only enhance the quality of the non-resident visitors' experience, but also promote Ghana's broader trajectory towards digitalization in public service provision. There is also one about reinforcing Ghana's position as a preferred destination. The 1.35 says amplifying economic benefits through tourism, and the 1.4 talks about the scope of this policy. Now, after outlining all of these as rationale for the policy, not the proposal, it appears to many people, as you have said before, that we went through a lot to put this together. If it is the view of Dr. Bernard Okoboy that we are changing our position on this matter, and that we have downgraded the policy to a proposal now, awaiting a fresh review and a fresh engagement of the highest authority in the Republic, especially when it comes to policy, which is Cabinet, that can be understood. We would understand that that's what we want to do going forward. And sometimes these things happen in our system, but mostly happens when new governments come in anyway. But within the same government, too, somebody may moot an idea, forward it to the highest level, and it will be downgraded along the line by a new minister who may not find it worthwhile pursuing, or may think that it requires some more review. If that is the rationale behind the statement from Dr. Bernard Okoboy, which is signed, it would Well, a lot more scrutiny will not do anybody any harm. You
But
get what I'm trying to say?
Raymond,
It will not do me any harm if there's further transparency and scrutiny on this matter. But to make it look like this is something out of the blue moon, out of the blue, nobody really knew it was happening. It's a proposal from within the circles of the NHIA, and the rest of us in government are not aware. As ministry, we have not even submitted same to cabinet, and cabinet has not approved it. It sounds a bit problematic. It sounds almost like you're throwing dust into the eyes of the people, and that's the one we want to be hearing from the current minister. So yes, there is still room for recovery on this matter. There's room for us to do what is expected of us, especially if we are not in the business of any monkey business. We are not going to do any shenanigans and how we do our business in the Republic. But if there's nothing to hide, if it's all transparency and for further scrutiny, I am not heavily opposed to it. I think that any policy in the Republic of Ghana may benefit from a lot more sunlight. It may benefit from a lot more scrutiny and a lot more views that are aimed at improving it.
you see, nobody is against a health insurance scheme for persons visiting the country. Why would you be against it? After all, when they come here. But you see, Raymond, this is if you go to page 28 of the document, so roles and responsibilities, so 4.2. Okay, it talks about the roles and responsibilities matrix. Let me read it very well. Objective 1, to establish a framework for the operationalization of the National Non-Resident Visitors Health Insurance Scheme. The strategy will be to develop a standardized and comprehensive NNRVHIS across the country. And listen to this. Develop a framework for licensing public commercial health insurance scheme entities, okay, for administering the National Non-Resident Visitor Health Insurance Scheme. Responsibility, Ministry of Health or the National Health Insurance Authority. Collaborator, Ministry of Finance, Ministry of Foreign Affairs and Regional Integration, Ministry of Interior, then you have Ministry of Transport, Ministry of Tourism, Arts and Culture, Ghana Health Service, GIS, GTA, Christian Health Association of Ghana, and private health insurance schemes. It's here. Then you talk about establish a system for public awareness creation and set up a system for collecting and addressing grievances. So, you see, the setting up a system for public awareness creation, you can see what's happening. So, last month, the National Health Insurance Authority CEO tells you this is his plan.
Yeah.
He's been engaging in stakeholder consultations.
And before that, he actually has been listing whenever he's talking about the four key pillars that he wants to operate with. Yeah.
Yes. And whenever he has stakeholder consultations, he talks about these. Mm-hmm. So it cannot be something that he is not aware of. I mean, are we saying that this is a document that we've actually loaded onto a website? This is the document outlining everything that we intend to do. You know what government is doing by this letter back and forth? It is actually leading people to now begin to ask questions and say, hold on a minute, is there something fishy?
Yeah.
You have to come clean. You have to come clean. Look, you can just say, you have decided that today anybody who is coming into this country should get an insurance scheme. Okay? So we would get these insurance companies teaming up with other people. So if you are focused on health, if for instance as NHIA or Ministry of Health you are interested in the health aspect of it, you get the health insurance companies to engage in partnership with others who provide travel insurance to do that. Why must it be, oh, it's not the case, it is the case, it's not the case, it's the case. Now there's evidence of the policy. No longer a proposal. Now, someone sent me a message and said, it says every health insurance company approved by the regulator should qualify. They have been approved for Ghanaians, so they automatically qualify for our guest. You get it?
No, I get your point.
Yeah. Yeah.
I think this would have been much ado about nothing if if we don't know the kind of system we find ourselves in. We tend to operate mostly under cover of darkness. You just wonder why. We always have something afoot when we are doing policy or putting it together, the ideas of state and all of that. So it will sound as if, oh yeah, they're about to do frontiers again. So how do we safeguard against that? Because in the same policy, do you know what we're quoting? They say it is $30 to $60. That's what the other countries are actually paying and charging others. Ours our own 45 to 270. Who determined the parameters for that? If your spectrum that you determine in your policy said $30 to $60, why are we looking at 45? Except, I mean, it's very possible that we'll be told that the 45 to 270 is also part of the, proposal, which is not being settled on by anybody. But what is even informing this, and he talks about the actuarials required there, somebody would have done a bit more work, very prudent statistical work, to give us this value and the requirements that are involved in there.
Raymond, we need to go for some messages from our partners.
Certainly.
When we come back, we'll conclude on even the idea, the fact that part of it is a revenue generating scheme that says today, because Ghana has become a destination, you are presented with an opportunity to raise some revenue.